This is Med School Radio. Welcome back to Med School Radio, everyone. We're going to be looking at Clostridium difficile infection. I'm just reading the Wikipedia page and looking at some of the parts and reading them out loud. So let's look first at how C. difficile spreads. So first imagine a doctor's office. George, a 68-year-old man, goes to the doctor's office and is diagnosed with pneumonia. He is prescribed antibiotics, drugs that put him at risk for C. difficile infection for several months. Now think about a hospital. 1 month later, George breaks his leg and goes to a hospital. A healthcare worker spreads C. difficile to him after forgetting to wear gloves when treating a C. difficile infected patient in the next room. Now think of a rehab facility. 2 days later, George transfers to a rehab facility for his leg and gets diarrhea. He is not tested for C. difficile. The healthcare worker doesn't wear gloves and infects other patients. Next, in the hospital. 3 days later, George goes back to the hospital for treatment of diarrhea and tests positive for C. difficile. He is started on specific antibiotics to treat it. Healthcare workers wear gloves and do not spread C. difficile. And then George recovers. Okay, so now we're going to go back to the main page. We can see a pathological specimen showing pseudomembranous colitis. And let's look at the summary that is offered. Okay, first the symptoms: diarrhea, fever, nausea, abdominal pain. Complications: pseudomembranous colitis, toxic megacolon, perforation of the colon, sepsis. Causes: Clostridium difficile, spread by the fecal-oral route. Risk factors: antibiotics, proton pump inhibitors, hospitalization, other health problems, older age. And diagnostic method: stool culture, testing for the bacteria's DNA or toxins. Prevention: hand washing, terminal room cleaning in hospital. And the treatment is metronidazole, vancomycin, fidaxomicin, fecal microbiota transplantation. So there we have it, a very quick summary of the Wikipedia page for Clostridium difficile infection.